Hi, my name is Dr. Brian Meek. I'm the pain management physician for Advanced Bone and Joint. I'm just going to talk to you today about stimulation therapy, or what people refer to as spinal cord stimulation. This is a procedure that's used to help patients with typically two diagnoses. One is patients who have had back surgery who are continuing to have significant lower back pain or pain that runs down their leg, or sciatic pain following the spinal surgery. In these situations, sometimes repeating the back surgery is not beneficial and can lead to further pain and discomfort. And so this treatment that's been around since the 1980s can be very effective in helping people reduce their pain and improve their function. The other diagnosis, called complex regional pain syndromes, typically occurs after an injury to a nerve or to an extremity. And at this point, if you're watching the video, you've likely gone through various treatments to try to make that better. Complex regional pain syndrome can also be very painful, and spinal cord stimulation therapy has been shown to be very effective in managing that and improving its pain and discomfort. The spinal cord stimulator is a very minimally invasive procedure. The other benefit I see of this is that there's few things in medicine where you actually get to try out the therapy first. So before you actually get implantation of the spinal cord stimulator, you actually get to try the device for a period of 5 to 7 days. During that time, you're able to feel the way you're going to be with the stimulation therapy. You're able to experience any relief that you may feel and see if this is going to be a treatment option for you. That's very rare in medicine where you can try a therapy like that, and is, I think, one of the greatest advantages. The procedure, the trial, is very simple. It's typically no more different than getting an epidural steroid injection through a needle, and utilizing X-ray, we're able to guide a spinal cord stimulator lead, which is, again, kind of like a thick fishing line. It's very flexible and safe. This then gets put next to the nerves that are being affected for the stimulation. We're able to map out each area where people have pain, and we make sure we get coverage. It's a little different for every person, and but we kind of know where to start based on that. Once we have good stimulation during the trial, you then you have a dressing that's put over that, and then you go home and you try to see how you feel with the treatment. If you receive a significant reduction in the pain, which we typically say is anywhere between 50 to 70%, likely we'll recommend implantation of the spinal cord stimulator system. Essentially, it's the same procedure all over again, with the caveat that we then hook up the spinal cord stimulator lead and implant a very small device that's about a quarter of a pack of cards. It's similar to like a pacemaker that people have placed in. This thing gets attached and put under the skin. You're able to communicate to that device by utilizing a really simple remote, and this has been developed over a long period of time, and then basically utilize the therapy and change what you're experiencing. Simulation therapy, again, has been around for multiple decades, but there's really not been much more of an exciting time to use this therapy. We're now utilizing multiple different ways to stimulate, multiple waveforms, and are really able to capture a large amount of pain for patients who utilize the therapy. This is, again, a very minimally invasive procedure. There is no surgical downtime. You're able to do this as an outpatient and do very well. If you have any further questions, there's obviously multiple other resources that we can speak with you about, and we're happy to answer any questions that you may have.